Good morning, everyone, and thank you for being here today. I am excited to introduce my presentation on echocardiogram. My name is Hazmat Ali, and I hold a Master of Science in Occupational Therapy and Anesthesia Technology. In this session, we will explore what an echocardiogram is, how it works, and its significance in cardiac care. We'll cover the basics, some key techniques, and its clinical importance. So let's get started. Let's talk about what an echo actually is. An echocardiogram, also called an echocardiography or simply a heart ultrasound, is a really useful tool in cardiology. It's a non-invasive, painless test, which means it doesn't require any incisions or needles. Instead, it uses high-frequency sound waves, kind of like sonar, to create images of your heart. These sound waves bounce off the heart structures, allowing us to visualize the shape, size, and how these structures move during each heartbeat. This helps us get a clear picture of how well your heart is functioning, and it's a crucial part of diagnosing various heart conditions. Throughout this presentation, we'll see how this simple yet powerful test fits into the broader picture of heart health assessment. Let's take a moment to explore the fascinating history behind echocardiography. In 1953, Dr. Helmut Hertz from Sweden obtained a commercial ultrasonoscope. At that time, this device was primarily used for non-destructive testing, such as inspecting materials without damaging them. What's particularly interesting is that Hertz saw potential beyond industrial uses. He collaborated with Dr. Ng Edler, a practicing cardiologist in Sweden. Together, they started experimenting with this ultrasonoscope to examine the heart, which was quite innovative at the time. This collaboration is widely recognized as the birth of clinical echocardiography as we know it today. It marked the beginning of using ultrasound technology directly on patients to visualize cardiac structures, revolutionizing how we diagnose and understand heart conditions. Connecting these points, we see how technological innovation and clinical collaboration laid the foundation for modern echocardiography, tying into our overall theme of technological advances transforming medical practice. Today, I'll be discussing the purpose of echocardiography and why it's such an essential tool in cardiology. An echocardiogram is indicated for a variety of reasons, and understanding these helps us appreciate its value in diagnosing and managing heart conditions. First, it's crucial for detecting and evaluating valvular abnormalities. These are issues with the heart valves that can affect blood flow, and echocardiography allows us to see these problems clearly. Next, it helps us detect atrial tumors, which are abnormal growths in the upper chambers of the heart. Identifying these early can significantly impact treatment options. It also provides a way to measure the size of the heart chambers. Knowing whether the chambers are enlarged or abnormally small gives us insight into various cardiac conditions. In patients with congenital heart disorders, those present from birth, echocardiography is vital for evaluating the chambers and valves, giving us a detailed picture of the structural changes. It's also instrumental in diagnosing hypertrophic cardiomyopathy and related cardiomyopathies, where the heart muscle becomes abnormally thickened, affecting its function. Furthermore, it allows us to evaluate cardiac function and wall motion, especially after a myocardial infarction or heart attack. This helps assess how well the heart is pumping and if there are areas of damage. Finally, echocardiography can detect pericardial effusion, which is fluid accumulation around the heart, and mural thrombi, which are blood clots attached to the heart wall. Overall, these purposes highlight how echocardiography is a versatile and invaluable tool in our diagnostic arsenal, helping us assess the structure and function of the heart thoroughly. Let's take a closer look at the working principle behind ultrasound imaging. First, the probe, which is also called the transducer, sends out high-frequency sound waves. These are ultrasonic waves, through the chest wall toward the heart. These sound waves travel through the tissues until they reach the heart structures. When they hit different parts of the heart like chambers, valves, or vessels, they bounce back. This process is known as reflection of sound waves. The probe then receives these reflected sound waves and converts them into electrical signals. Finally, These signals are processed to produce images that are displayed on a monitor. This allows the technician or cardiologist to analyze the heart's structure and function in real time. So, the entire process involves sending, bouncing back, receiving, and converting sound waves to create detailed images of the heart. Let's talk about some of the key technologies behind modern cardiac imaging. First, we have pulse echo technology. This method measures how long it takes for sound waves to bounce back after hitting tissues. By doing this, it calculates distances and helps create detailed images of the heart's structure. It's like hearing echoes and using that information to build a picture. Next is Doppler technology, which is really fascinating. It measures the frequency shift of sound waves as they reflect off moving blood cells. This allows us to assess blood flow and velocity within the heart and vessels, giving us vital information about how well the heart is pumping and if there are any flow abnormalities. Finally, we have 2D and 3D reconstruction. These techniques combine multiple images to give us both flat, two-dimensional views and more complex, three-dimensional models of the heart. This not only improves our understanding of heart anatomy, but also enhances diagnostic accuracy. All these technologies work together to provide a comprehensive picture of cardiac health, aligning perfectly with the overall theme of advancing medical imaging to improve patient outcomes. Now, let's talk about the different types of echocardiograms. The most common one you'll encounter is the transthoracic echocardiogram, or TTE. This test involves placing a probe on the chest wall, which then sends ultrasound waves to image the heart. It's non-invasive, quick, and provides a lot of useful information about heart structure and function. On the other hand, there's the transesophageal echocardiogram, or T. This technique involves inserting a probe through the mouth or nose into the esophagus. Since the esophagus is located right behind the heart, this approach gives us a much clearer, more detailed view of the heart's rear structures. Both types serve different purposes depending on what we need to see, but understanding these options helps us tailor the best diagnostic approach for each patient. As we move forward in this presentation, keep in mind how these different techniques fit into our overall strategy for evaluating cardiac health. Let's take a closer look at the imaging techniques we use to visualize the heart. First, we have the 2D echocardiogram, which creates two-dimensional images of the heart structures. This method is highly valuable because it provides clear, real-time images that help us assess the heart's function and anatomy in a straightforward way. On the other hand, there's the 3D echocardiogram, which, as the name suggests, creates three-dimensional images of the heart structures. This technique allows us to see the heart in more detail and from different angles, giving us a more comprehensive view. Both imaging methods are crucial tools in our diagnostic arsenal. They help us understand the heart's anatomy and function more precisely, which is essential for accurate diagnosis and planning treatment. As we progress through this presentation, you'll see how these imaging techniques connect to overall patient care and the importance of detailed visualization in cardiology. Let's talk about preparation for these procedures. For transthoracic echocardiography, or TTE, there's actually no special preparation needed. You just need to have gel applied to the chest area, which helps the ultrasound transducer make good contact with the skin. After applying the gel, the technician moves the probe around on the chest to capture clear images of the heart. It's a straightforward process and generally very well tolerated. On the other hand, for transesophageal echocardiography, or T, the situation is a bit different. Since this is an invasive procedure, it requires sedation to ensure patient comfort and safety. Sedation helps the patient relax and makes the procedure smoother, but it also means you'll need to be monitored carefully throughout. So to sum up, TTE is simple with minimal preparation, just gel and positioning, while T involves a more involved process with sedation, given its invasive nature. Both are valuable tools, but knowing the preparation details helps ensure everything goes smoothly. What echo shows us is incredibly valuable for understanding the heart's health. It allows us to see the size and function of the heart chambers, helping us determine if they are working properly, or if there's any enlargement or unusual shape. Next, we look at the valves and blood flow, making sure the valves open and close correctly to prevent any leaks or restrictions. We also assess how well the heart muscle contracts and relaxes, which is key to understanding overall cardiac function. All these details together give us a comprehensive picture of the heart's performance, highlighting how echo is such a powerful tool in diagnosing and managing cardiac conditions. Now, let's take a closer look at what an abnormal echo can reveal. When we see an enlarged heart chamber, it often indicates that the heart is working harder than it should, possibly due to underlying conditions. This enlargement can affect how well the heart functions overall. Poor heart function and blood flow are common consequences, meaning the heart isn't pumping blood efficiently to meet the body's needs. It's important to understand that the heart's ability to contract and relax properly is essential for maintaining effective blood circulation. When contraction or relaxation is impaired, it can lead to symptoms like fatigue or breathlessness. So, in essence, these echocardiogram findings give us valuable clues about the heart's structural and functional health, helping us diagnose and manage various cardiac conditions effectively. Now, let's take a closer look at some of the common diagnoses associated with heart failure. When we say diagnosed heart failure, we're talking about a condition where the heart's ability to pump blood effectively is compromised. This can stem from several underlying issues. One major cause is coronary artery disease, which involves the narrowing or blockage of the arteries that supply blood to the heart muscle itself. This reduces oxygen delivery and can weaken the heart over time. Another key factor is cardiomyopathy, a disease of the heart muscle that causes it to become enlarged, thickened, or rigid, impairing its function. Valve disease is also significant. When the heart valves don't open or close properly, it can lead to inefficient blood flow and strain on the heart. All of these conditions are interconnected and contribute to the overall picture of heart failure. Recognizing these diagnoses is crucial because they help us target the right treatment strategies and manage the disease more effectively. So, understanding these underlying causes really highlights the importance of early detection and intervention in heart failure management. Now, let's look at the benefits and risks associated with this procedure. On the benefits side, it's a non-invasive technique, which means it doesn't require surgery or going through the skin, making it much more comfortable for patients. It's also painless, so patients typically experience little to no discomfort during the process. And perhaps most importantly, it provides accurate results, helping us make reliable diagnoses and treatment decisions. Of course, no procedure is without some risks. For example, during a T, patients might experience nausea or vomiting, which is fairly common and usually temporary. There is also a small chance of complications arising from the procedure itself, but generally, these risks are minimal and manageable. Overall, while we must be aware of these potential issues, the benefits, particularly its non-invasive nature and accuracy, make it a valuable tool in our diagnostic arsenal. Understanding both sides helps us better inform and prepare our patients for what to expect. Thank you so much for your time and attention today. I really appreciate the opportunity to share these insights with you. Remember, the key points we've discussed highlight the importance of understanding our audience, leveraging the right strategies, and continuously adapting to change. These concepts are at the core of achieving success in any project or initiative. I hope you found this presentation valuable and that it inspires you to take actionable steps forward. Once again, thank you for being such an engaged audience. I look forward to seeing how you apply these ideas in your own work.